So as a country, from last year, we have been working through a process for responding to a national mental health inquiry, and that process indicated that there were major gaps in services, workforce, and the response that we have to people in our community for their mental health and wellbeing. So over the last year, we had government come up with a budget of $1.9 billion, the largest budget we've ever had for mental health and addiction care. And that budget has enabled us to get started on filling some of the gaps for our communities in a mental health response. And that includes 4 priorities to begin with. One is to reform the Mental Health Act in New Zealand, so looking at repealing and replacing the Mental Health Act and decreasing the use of legislation. The second is the establishment of a suicide prevention office. The third is the establishment of a mental health and wellbeing commission, and the fourth being increasing access and choice to services through primary community wellbeing. So over the next 5 years, we are funding and growing new services in primary and community settings. Then COVID hit us in about January. The rest of the world, we were all thinking about what would happen from COVID. In New Zealand, we have experience of having to respond to a number of events. The Christchurch earthquakes, last year we had the mosque shootings in Christchurch, and we've had Whakaari White Island, so that was a volcano exploding, for those of you who may not have heard, and then COVID hit. So our responsibility in the Ministry of Health is, from a psychosocial perspective, to come up with a plan and how we would support the psychosocial recovery for our communities. And every situation has been unique, but what we know is that the pandemic or the disaster event needs to be responded to from a mental health and wellbeing perspective. So we do expect the psychosocial impact for COVID-19 to have an enduring effect on people's mental health and wellbeing. And when we first were entering COVID-19, we decided that we would think about, from an evidence-based perspective, the actions that we needed to take as a country to get in front of what was going to be perhaps a harmful event. So rather than waiting for us to be 6 to 18 months down the trail and then take action, we wanted to get in front of that. So the psychosocial plan, and it's called Kia Kaha, Kia Maia, Kia Aotearoa, and that translates to, through strength and endurance, our wellbeing will prevail in New Zealand. So this plan is a 6 to 18 month plan, and it describes, from a wellbeing perspective, what we need to do to get in front of the COVID tail for psychosocial response. We know from the Christchurch earthquakes that many members of our community were impacted for their mental health and wellbeing, particularly young people. We know for this pandemic that it's not necessarily going to be the issue of enduring isolation, because, as you'll be aware, New Zealand's relatively quickly managed to come out into level 1 now, but it is more the economic factors where our tourism industry and other employment industries will be impacted through COVID-19, and that is going to have a potentially detrimental impact. So the actions that we've got in our national plan are aimed at wellbeing and supporting people early, and what are the things that people can do to lessen the tail of COVID from a psychosocial perspective. The actions that we are putting into place and have done very early, so as soon as we went into lockdown, we got a fund of $15 million for resources that would be focused on wellbeing and what people could do to help themselves. So those were a combination of apps, wellbeing campaigns, online programs that people could do in their own homes, or where they have phone support, so telehealth services. And those will endure over the next 6 months. So even though people have come out of isolation and may be back in their communities, we really want them to continue to grow their strength and resilience around wellbeing. And the actions that we take now, we know, will prevent people having to go into specialist mental health services or get more intensive treatment and support. The The way that we have, you will see a model in the plan, which is an upside down triangle. And basically, most of the opportunities for people to get support have been that they've had to wait, or that they go through a traditional medical pathway. So we wanted to take the approach that we would get in early and use a population mental health and wellbeing perspective. And so our work right now is changed completely as a directorate in the team in the Ministry of Health, that now we are doing lots of wellbeing messages, and the resources that we are reprioritising are for anyone in the community to use, for their families to use, lots of education, how you lessen the impact for mental health and wellbeing for COVID. We've had a lot of contact with services, a lot of interest in this plan, and what we are doing is making sure that we adjust the actions in the plan according to population need. It's going to become very important for us to measure our progress, to understand what needs there are in the community, and for us to respond accordingly. So we've deliberately kept a high level plan, but with enough flexibility that we can adjust our actions and maybe readjust our funding priorities accordingly. And it's really been a reflective moment for me that we can spend a lot of time consulting on a strategy and not getting it right. And this was very intentionally about taking action, and taking action now, responding to need, and being flexible. So that's the approach that we're taking, and it builds on the mental health inquiry work that we had already underway, and will help us build and strengthen that, and also put mental health into the spotlight for New Zealand as we come through recovery.